Hi, everybody. My name is Christina Stapke. I am an integrative registered dietitian nutritionist, and welcome to Autoimmunity in the 21st Century, Reversing and Preventing instead of Temporary Symptom Control, where I'll be interviewing autoimmune expert David Vilstrom, and he's going to tell us a lot of different things in this interview. One of the things is going to be the biggest struggles people face with autoimmune disease, also the biggest myths out there, and most importantly, what someone can do if you have an autoimmune disease or if someone that you know and love has an autoimmune disease, and also how to prevent them from happening in the first place. So kind of just before diving into everything, I just wanted to preface this video by saying we're going to be talking about educational material. None of this is directly intended to convey any medical advice. So if you have any questions about specific testing or what might be right for you, considering whatever you have going on, definitely ask your doctor, seek out an integrative and functional practitioner that might be able to help you kind of do some digging into what's going on with you. And I would love for anyone that's watching to like, comment, share, send this to anyone that really you feel like might benefit, that either has an autoimmune disease or just wants to learn more. So today we do have Dr. David Vilstrom. So like I said, he is an expert in reversing and preventing all autoimmune disease. And he is actually quadruple board certified, including having specialties in integrative and functional medicine. And we're super fortunate to have him here today because he is in Mexico right now, living the autoimmune lifestyle. You guys, this is what passion is doing something like this while you're on your vacation. So we really appreciate you being here, Dr. Vilstrom. And also he's an avid inbounds backcountry snowboarder. So this is probably the last time you'll see him out of the Rocky Mountains in the US until the snow melts in May 2021. So Dr. Vilstrom, thanks so much for being here.
Oh, my pleasure. So happy to be here.
Yeah, so I'm really excited to dive into this. So just tell us a little bit about your practice in general.
Well, my practice is in southeast Idaho in the Rocky Mountains, not too far from Jackson Hole. And I partnered with a teaching hospital, Bingham Healthcare, to put together the first of its kind practice where we're trying to educate people that other options exist besides the more traditional options for autoimmune disease. We're trying to educate people that basically all the autoimmune diseases are actually just one disease, that it can attack any body part. And we're trying to educate people that we actually know what causes autoimmune disease and we know how to reverse it. So we're trying to, in our clinic, what we do in our clinic is we see people from all over the country and teach them how to reverse the autoimmune disease that they already have or multiple autoimmune disease, but also put them in a position to not get new autoimmune diseases on top of their first, second, or third autoimmune disease that they already have, and ideally make this the standard way of dealing with autoimmune disease rather than the more traditional way.
Yeah, awesome. I love how you are, it's a perfect example of how functional medicine and integrative medicine and conventional can kind of work together and start talking and communicating. So I think it's really, really cool that you're in that hospital system. So wonderful. And just tell us about kind of what got you into this and what made you decide to focus on autoimmune disease in particular.
Oh, sure. Yeah. Well, I've been involved in chronic disease for decades. And ideally, I've always loved trying to take care of the folks that have the most complex health issues. So actually, originally my area especially was spinal cord injury, where everybody that I saw was paralyzed from the neck down or the waist down. And very complicated folks. The physical medicine and rehab docs like myself became their primary care physicians because their healthcare was so complicated. It's just something that you and I wouldn't think twice about taking over-the-counter medicine, like maybe a sinus medicine. We wouldn't think twice about it. For them, it might kill them. And so we really had to know the ins and outs of spinal cord injury. But then we also had to use a lot of crazy medicines and really use them for their side effects. So, they'd have all these health issues, and we would use medicines that nobody else uses because the side effect potential was so ridiculous. But that same side effect is what we're trying to achieve with this population, where, it could be something that nobody else could take because it would make you so darn constipated, you would never take the medicine. You couldn't use it. But if we had somebody that had issues with bowel continence, for example, it might be the good medicine, because it would keep them, from having accidents when they're out in the community. So we got real familiar with using medicine for their side effects, but then they would have other side effects that would just get in the way of things. We had to go from medicine, and it wouldn't take too long to run out of medicines, whether it's for their nerve pain, the spasticity, whatever it was. And it got me thinking, geez, wouldn't it be lovely if there's something else out there for these folks that I don't know about? And wouldn't it be lovely if it turned out to be something without side effects? As I dug deeper into this, acupuncture kept coming up. And turns out acupuncture is great for so many things, and it doesn't have any side effects, basically. So I actually felt like, well, where I was practicing at the time, there wasn't really any acupuncturists anyway, but definitely no acupuncture knew spinal cord medicine. So I said, well, I'm going to have to learn this. So I went to UCLA, trained in trained in acupuncture, came back, and oh my gosh, it works so beautifully. And including, I had 11 different rehab partners. We were at a big 200 plus bed rehab hospital. And when we couldn't help people, there was nobody else to send them to. We were the kind of the people that patients got sent to us when nobody else could help them already. And so my 11 partners were like, oh, we have this potentially great new intervention. And sure enough, oh my gosh, it works so much better. But it got me thinking then, so if I went all the way through med school and all the way through residency, and actually I did my residency at University of Colorado, which is a fairly progressive environment for medicine, and I didn't learn a lick, not even one word about anything about acupuncture. I said, well, what else is out there that I don't know about? And sure enough, there is so much information out there about how to take care of people with chronic health issues. And one of the challenges for, I think, medicine in general, the more traditional allopathic medicine, is there has been such an amazing explosion of medical data in the last 50 years, but particularly the last like 30 years, that it's real easy to think, well, we don't know about that. When if you actually look into it, you're like, oh my gosh, there's thousands of studies about that. And so turns out there's thousands and thousands of studies about what causes autoimmune disease and how to reverse it. Now, my interest in autoimmune disease kind of stemmed from this. I want to help people that tend to be the other people can't help. But since I've been in medical school, the amount of people with autoimmune disease has just skyrocketed. So like when I was in med school, and it wasn't that long ago, it was quite a while ago, but not that long ago, like 1 in 400 people got an autoimmune disease. And now it's 1 in 12, 1 in 9 women. And so there's more people are diagnosed with autoimmune disease every year than are diagnosed with cancer and heart disease combined. And about 50 million Americans, I think, that have autoimmune disease. And that number might be underestimated because pretty much every week we're learning about how that autoimmune process, where the immune system becomes confused and attacks our own body parts, how that autoimmune process is associated with so many chronic diseases that we never thought had this autoimmune component. So like here's cardiovascular disease, where people get heart attacks and strokes. Well, it turns out the immune system can get confused and attack the lining of the blood vessels within the heart. They swell, narrow, you get a heart attack. Or osteoporosis, the thinning of the bones. Well, it turns out you can actually attack the bones and you start losing all your bone strength. And this goes on and on and on. And so I'm just super excited that this is my chosen passion, because it's becoming more and more important every day. Typically, the options that people are given when they're the more classic autoimmune disease, or when an autoimmune disease process is identified, are medications that only put a bandage on the symptoms. So you have rheumatoid arthritis, we can kind of help you a little bit with this joint pain. Hey, you have psoriasis, we can do a little something for the skin. Hey, you have multiple sclerosis, we can kind of do something for this brainy thing that's going on. Unfortunately, because they tend to suppress the immune system, you're at increased risk for getting infections that might kill you, and cancers like lymphoma. But also, there's thousands of studies that show that these immunosuppressants will actually give you a new autoimmune disease. So as you're trying to control the symptoms of the autoimmune disease you already have, they can give you more autoimmune disease. And by not fixing the reason why you got the autoimmune disease in the first place, you just keep getting one after another, after another, after another. And you never feel your best because you're not really getting at the heart of the matter, but then you just keep getting worse and worse over time. And that's not the best scenario, especially when we know so much about what causes them, and we have tests to run to tell us why people get them and put us in a position to actually make them go away.
Wow. Yeah. I love your story. I actually learned something new about you. I don't think I knew that you were trained in acupuncture at UCLA. That's awesome. So yeah, you kind of started off in spinal cord injuries, learning about how medications can actually help side effects, or, cause a certain effect that you're looking for your patients. And then it sounds like acupuncture kind of just opened up the world of integrative and functional medicine. And what else do I not know about this? What else was not in my conventional training? So that's really incredible. And it really speaks to the fact that the amount of research that's out there right now just simply hasn't caught up to our current curriculum. I was not in medical school, but that's what I'm hearing, is that there just simply is not a sufficient training in chronic illness and disease prevention, reversal and treatment. And so yeah, it'll be exciting when research is finally catching up to curriculum, right?
Well, I think the research is outpacing the curriculum. We're still kind of in that, well, what medicine do we have for which symptom?
Right.
Versus here's all this data where, if your blood pressure is like 220 over 140 and you're at risk of stroking out, having a heart attack, well, the medicines come in quite handy. But ideally what the medicines should do, and even the ones that are used for the autoimmune diseases, they should, you got to get through your day. You don't want to have a stroke. You don't want to have a heart attack. You don't want to have such tremendous joint pain you can't get off the couch, take care of the kids in the morning, or you're so darn fatigued, or your skin is so itchy you just can't get through your day. So the medicines that are available are good at kind of, getting you through your day. But ideally they should be used, if they are used at all, used kind of as a temporary fix. Well, let's make sure you can get off the couch. Let's make sure you don't die. But then that should buy us time to go back and go, okay, let's do our due diligence here. Let's do what we need to do to figure out why this is happening, because usually it's not just that one symptom. It's not like somebody has super high blood pressure, but they also got insulin and blood sugar issues, pain issues, fatigue issues, sleep issues, brain fog issues, all this menstrual stuff, all this stuff going at the same time. So putting a bandage on one symptom just to get through your day, well, you got to get through your day. But let's go back and do our due diligence and find out why you have the one that needed this medicine. Let's say that's probably the exact same reason why you have all this other stuff, including all the autoimmune stuff. And then we can go in and actually get rid of it. And, oh, by the way, your blood pressure comes down. You don't need your blood pressure medicine anymore.
Yeah. And we love when that happens, right? When we can actually address the root causes. I want to come back to something you said earlier, talking about the autoimmune component of heart disease and osteoporosis. I think that's something that people just take for granted, that that's just something that happens and it is not necessarily autoimmune related. So I think it's super important for people to understand that there can be an autoimmune component with even those kinds of illnesses and diseases.
It is so cool what we know. So here's this one that I like talking about, is voltage-gated potassium channels, VGKCs. And these are autoimmune diseases that attack the nervous system. So here's seizures and migraine headaches and neuropathies and all this kind of stuff, autoimmune component there too.
Yeah.
And so somebody might come in, well, I have migraines and I have regular headaches and I got this neuropathy, and oh, by the way, I got rheumatoid arthritis and I got osteoporosis and all these things. And they seem so disparate, like they're not connected, where actually it's all autoimmune. And when you get one autoimmune disease, I'm always I suspect highly that everything else they got might have an autoimmune component to it too. But also what tends to happen is the things that cause the immune system to become confused and attack the body itself, these autoimmune processes, these autoimmune diseases, the drivers of those are such big drivers of chronic disease in general, that as you fix the autoimmune issue, you're basically fixing the reason why they got all the other stuff. So, you're getting rid of cardiovascular risk. Maybe it's not an autoimmune cardiovascular risk, but you're getting rid of the cardiovascular risk because of what you did for the immune system itself.
Right. Yep. Inflammation too. We know that vicious
Mhm.
cycle. So yeah, awesome. And I'm really excited to kind of talk more later on this interview about kind of how to address those root causes. I'm sure our viewers are really curious to find those out.
It's fascinating. It's fascinating. I can't wait to talk about it.
Yeah, I love it. That's why you're here on your vacation, right? You love this stuff. So just kind of through your experience over the years seeing patients, what have you really noticed the biggest struggles have been, especially with people with autoimmune disease?
Well, I think probably the biggest struggle is knowing that there's another option between besides the option presented by whoever has diagnosed you. So you're basically, well, here's this disease, and you go, geez, I didn't want that. And then you might ask the person that diagnosed you, the physician, let's say, well, how did I get that? Well, we have no idea why you would get this autoimmune disease. Oh, well, what can we do to get rid of it? Oh, you can't get rid of it. You're stuck with it whole life. Well, you know, and so right there, you're like, well, this doesn't sound so good here, you know? And then they go, what's my option? My options? Well, actually only one option. Here's this medicine that's going to suppress your immune system, basically. And, you know, DMARDs and biologics, steroids, all these kind of things. And they go, but oh, by the way, these things that suppress your immune system, you're much more likely to get cancer, and you're much more likely to get this infection that no amount of antibiotics is going to be able to get rid of, and you might die. And oh, by the way, they might cause you to get a new autoimmune disease. And because we're not really treating, you know, getting rid of the reason why, it's highly likely when people get one autoimmune disease, they're going to get a second and a third and a fourth. And you go, well, how discouraging is that? I mean, right away, it's like, well, you know, in medicine, you know, if you think bad things, well, in life, you know, almost like if you think bad things are going to happen, they're probably going to happen. If you think good things are going to happen, you're probably right. They're good things are going to happen. So when you have a chronic issue, you want to be optimistic. You want to, you know, I know, you know, and if you're like totally bummed out and you think, you know, well, there's nothing that's going to happen. Something's going to get worse and worse and eventually die this tragic death. They're like, well, you know which direction you're going to go, right? And so it's terribly demoralizing when, in fact, because of all the data we know, we know what tests to run to kind of figure out how people why get these things, and we're in a position to kind of prevent them or get rid of them and prevent them. And so, you know, when you say, well, actually, you know, we know what causes autoimmune disease, and so we can test and find out why you got it. And then if we can identify, you know, why you got it, we're in a position to actually address why you got it. And then you're in a position to get better and better as time goes on. And then you go, well, that feels a lot better when somebody kind of knows the whole story where, yeah, you might want these meds, but let's use them temporary, you know, get you off the couch, you got to get the kids to school, you got to get to your job, you know, but then let's go back and do our due diligence and really figure out what's going on. And then people get much more optimistic, and then they're willing to you know, to make changes to help themselves get better, versus if you think nothing's good could happen, you know, why even try, kind of a thing.
Yeah. Yeah, that's huge. So really it's just the biggest thing you've seen, at least prior to seeing you, it sounds like, is people just being told there's nothing they can really do. It's basically go on a medication that is, you know, has this laundry list of side effects, you know, including death and cancer, like all these terrible things. So yeah, really just empowering people with the information that, hey, we do have things that we can test for to figure out why you have this in the first place.
Mm-hmm.
So I love that. So I would love for anyone watching, if this resonates with you, definitely to like, comment, share. Yeah, just share this with people that you feel like this would be really helpful to hear. Because I know this stuff is so I mean, like Dr. Vilstrom said earlier, autoimmune disease is so incredibly common. And so people's symptoms that they might be dealing with that aren't just optimal in general could be a sign of early autoimmune disease or autoimmune disease proper. So we kind of dove into this a little bit just now, Dr. Vilstrom, but tell us about what the biggest myths are and what you see about autoimmune disease.
Oh, sure. Yeah. And so I think the biggest myths are we don't know why they happen, and we don't know how to reverse them. And you really can't blame people, physicians included, for not knowing this because of that huge explosion in medical knowledge. So like back in the 1850s, medical knowledge doubled every 50 years. So if you were, like, say, a doctor that came out of training, or a functional nutritionist that came out of training, right? You could practice for 50 years, and you just have to learn as much as you learned in school. But then here, like in 1950, it was doubling about every 20 years. By 1970, it was doubling every 7 years. I used to say for years, by 2020, this could be doubling every 73 days.
Wow.
But here we are in 2020, and I'm like, oh crud, it's already here. It's like every 73 days. So like, how do you keep up with this stuff, right? There's so much new data all the time that, you really can't blame anybody for not knowing this. But thus, you really have to be kind of an expert in autoimmune disease to really know this data, because it's just trying to keep up with the things that a practitioner is doing day in, day out. Like, well, I use medicines to address cardiovascular disease, or I use medicines to address GI stuff. Well, just trying to keep up on the medicines and the techniques, and scoping somebody and doing open heart surgery, just trying to keep up the techniques. That's like, oh my gosh, that's a full-time job almost, right? Mm-hmm. So unfortunately, because of that, there's a lot of data that doesn't get used when it comes to the preventing chronic disease, like you touched on, and reversing chronic disease. It's more like, I love the TV show MASH, and so wounded just coming in one time, all you can do is just kind of, just get through the crises. Mm-hmm. Whew, at least we got through that, but we really need to go back and figure out why these chronic diseases are happening. And actually, I think in general, kind of start addressing them and preventing them, rather than just kind of being this MASH unit that once somebody has their heart attack and they get their cancer and they've had their stroke and, all this kind of stuff, well, what are we going to do now? But instead, kind of go back and go, well, we know this stuff happens. And when it comes to autoimmune disease, it happens to a ton of people. And well, if we know it's going to happen, why don't we go ahead and prevent it? Or if it just starts showing up, okay, we kind of missed our opportunity to prevent it, but we can make it go away. But now we're preventing all the other stuff that happens later on in life. And what I hope we get a chance to talk about too is epigenetics. And so epigenetics is our genes. And we used to think our genes were hardwired. And whatever we got from our families, good, bad, you're kind of stuck with it. But what we know now with epigenetics is it's not so much what genes you have, it's which ones are turned on and turned off. And there's a lot of bad genes in our DNA that need to be turned off, and a lot of good ones turned on. So as all these things are happening, throwing the body towards autoimmune disease or multiple autoimmune disease, you're flipping all the genes the wrong way. And so you see this all over the world. So this is not just a United States problem, that we have the same rates of autoimmune disease in all the developed countries of the world, like Europe. But in all the developing countries, you're seeing as their genes start getting flipped the wrong way, they're developing a lot of these autoimmune diseases that were just totally unknown before. Like just even like 30 years ago, MS, multiple sclerosis, was pretty much unknown in Japan. And now it's like getting all really common. So you're flipping the genes the wrong way. But then what happens with that is, with epigenetics, is the genes, how they're flipped, get passed on from generation to generation. So you talk about how things run in families. Well, it's not so much a disease runs in families, is that the flipping of the genes the wrong way runs in families, and then you tend to get the same things. And so in a perfect world, actually what happens is you're reversing chronic disease, is you're flipping them the right way. And you go, oh my gosh, I feel better. And you go, well, of course, because every cell in your body now has the genes flipped the right way, and they're telling every cell in your body the right information rather than the wrong information. And if you can do that by age 19, really set the system well, flipping the right way, you just don't tend to get stuff as an adult, for example. So there's this critical period early in development where you want to flip in the right way. So, for example, the very best time to prevent breast cancer is before age 19. You just don't tend to get stuff. But then the next best time to do it, ideally, is before conception. Because what we see is if you can set the gene expression before conception, you're passing on cleaner genes the next 4 generations. The corollary is, if you don't know about this, and this is one reason why we're doing what we're doing, is to tell people this, is if you flip them the right way, well, the correlate, if you don't flip them the right way, you pass it on crummier genes the next 4 generations. So we're all sort of products of the previous 3 to 4 generations. So when you see a child, let's say with eczema, allergies, asthma, all immune system issues, recurrent infections, like recurrent ear infections, recurrent sinus infections, recurrent strep throats, you're like, well, that's all immune system disruption. The immune system, if I can mention this just for a sec. So the immune system is this beautiful example of how the body likes balance, where in most things in life, you don't want to be too high, too low. There's a sweet spot right in the middle. So when you lose that set point in the immune system, you go up and down at the same time. And so the up-regulated, overactive immune system issues are your things like your eczema, your allergies, your asthma, and your autoimmune disease. And then down here are infections and cancer. So you'll see this disruption of the immune system in children. They get recurrent ear infections, asthma, allergies, they've had eczema, and all this kind of stuff. And you go, oh my gosh, their epigenetics have flipped them the wrong way, and they're getting all this this immune system stuff already. Well, they're just a setup for as time marches on to start getting autoimmune disease. And then here's cancer. And a bazillion people get cancer, and a bazillion people get autoimmune disease. So you can actually see this disruption in children because of kind of what's had come down the pipe from the previous 3 to 4 generations, and oftentimes because of how common autoimmune disease is, and immune system disruption you see in the parents. You know, they have allergies and they've had autoimmune disease, and grandma had rheumatoid arthritis, and several family members had cancer, and all this kind of stuff. So you can really kind of see it coming downhill to the young people, and thus you see a lot of kids start getting this stuff. Or you see just the immune system disruption. They don't have like juvenile rheumatoid arthritis or this kind of stuff, but you give them about 2 more decades, and here's rheumatoid arthritis, lupus, ulcerative colitis, celiac disease, all this kind of stuff just coming down the path. So it's lovely if you can flip the genes before conception, because then the future generations would be so much better off.
Yeah. Oh my gosh. I think this is so mind-blowing for both me and for people watching. The matter of epigenetics playing such a huge role. Mm. So yeah, before preconception, and then from generations prior to before.
Yeah.
So, and I did want to touch on, because you said so much good stuff and all of that, I wanted to just come back to kind of the fact of research just progressing at such a crazy fast rate, and it not being able to catch up to modern day curriculum. I think what you mentioned about conventional docs specifically, just having to keep up to date with new medications, right? New medications and different methodologies that they're using in their specialty. I think it really speaks to how important collaboration is, right? Like having multiple practitioners to support our patients with, because we're all not going to be an expert at everything, right?
Oh, absolutely.
We need to support each other while we're learning such fascinating, awesome stuff every day. So, yeah, and I think one epigenetics example that I found really fascinating when I first learned it was the Holocaust survivor example of Holocaust survivors, and then families and generations after them all, have really high rates of chronic disease, and they've chalked it up to the epigenetics piece, flipping those genes on that turn on all the inflammation and things that probably set them up for things like autoimmune disease too.
Absolutely, and that ties in, and that kind of ties into multiple generations can be involved in the flipping the wrong way, but also the flipping early in somebody's life can do it good big too. So here's adverse childhood events. So this is like children and teenagers who have experienced divorce, separation, substance abuse, physical abuse, sexual abuse, verbal abuse, and things like that, how that flips the genes the wrong way. And then they have this incredible increase in all chronic disease as time goes on. So whenever you flip them the wrong way, whether it's 2 generations before, 1 generation when you're young, they get flipped ideally the right way right after conception, all the way to 9 months till birth, first 19 years of life before conception. You can kind of see where anywhere along here, if it's disrupted, it just really nails the person, but also, multiple generations. Absolutely.
Yeah. Yeah. And I think, again, we'll get to what kind of, or more of what can flip those genes on, because I'm sure people are really curious. Like, how can I turn those genes off? How do I do that? And we'll kind of go into this now. So why is it important to really address the root causes of autoimmune disease, and speak to some of those root causes, if you would?
Well, absolutely. Yeah. So the root causes of the disruption, loss of the set point, are vitamin deficiencies, hormone deficiencies or imbalances, toxicity, and unfortunately we live in a very toxic world. Heavy metals like lead and mercury and arsenic, cadmium, but also things like flame retardants, pesticides, herbicides, plastics, and all these kind of things. It's one reason why they think so many more people get autoimmune disease now than just a couple of decades ago. Toxic stress. So this kind of goes back to the cortisol, which is what you're talking about with Holocaust survivors, the adverse childhood events, those kind of things. Chronic infections, and then the gut. And the gut's a real big central mechanism. So these different things can throw off the gut, but once the gut gets thrown off, it throws off all these other guys. So once the gut gets thrown off, and it can get thrown off for a variety of reasons. Stress will nail the gut, and hormone imbalances nail the gut, and toxins nail the gut, and infections nail the gut. But the gut gets thrown off, you can't digest your food and get the nutrients out, you get vitamin deficient. And then the gut gets thrown off, you can't balance your hormones. And the gut actually makes a lot of important hormones, like the gut can make melatonin, for example. And we don't really need to give hormones nearly as much credit as they deserve for keeping us healthy. And so like people with higher melatonin levels, yeah, it helps with sleep-wake cycles. Pretty much everybody knows that. But also people with higher melatonin levels, less heart attack, less stroke, less Alzheimer's, less cancer. And you're like, that kind of sounds good, right? Gut, make all that you can. And then the gut gets thrown off. And it directly throws off the immune system, because 80% of the immune system surrounds the gut. And so when the gut gets thrown off, it throws off the immune system. And then when the gut gets thrown off, you can't get rid of toxins from the body. And every cell in our body makes these toxic byproducts of metabolism every day. We got to get rid of them. They're just terrible for us. And if you can't, they build up. And then we have all these environmental toxins now that the detox pathways have to deal with, including the gut. You can't get rid of those. So once the gut gets disrupted, and it can happen at a very young age, C-section versus vaginal delivery, not being breastfed, that's tough on the gut, tough on the immune system. Early use of antibiotics, recurrent use of antibiotics as a kid, stress as a kid, those adverse childhood events, cortisol nails the gut. So the gut gets thrown off early. That's where you tend to start seeing this immune system disruption, perhaps even as a kid. And because the gut's the second brain, it's going to throw off brain stuff. And so here you got, developmental disability, autism spectrum disorder, ADD, ADHD, anxiety and depression in teenagers, and the suicide rate is crazy. And so the gut gets thrown off. It really throws off every body part so big, including ultimately it then drives the immune system crazy, and then it starts attacking our own body parts.
Wow. I was just reading Ginger Allen's question here. You said so much good stuff in that. And I just wanted to come back to, vicious cycle, right? A big takeaway from all of that is, wow, the gut is connected to everything, and toxins and stress and nutrients can all feed into gut health and take away from gut health. So definitely something to really consider. So I wanted to read what Ginger asked us here. Can you tell us how parents can help children who show signs of autoimmune issues, and how do you flip those genes?
Yeah, so I think, so already there's going to be some disruption if a child's going to show that. And so it's not like, oh my gosh, I see a little symptom, that must have just started yesterday. This is already kind of in the works, previous generations, but already all the way through the child's life. And so I think one thing is, kids are such good healers. We can turn adults around, but kids just are fantastic healers. They turn this stuff around so much quicker. So typically doing things like meeting with somebody like yourself, say, okay, this is the importance of good nutrition. Hot flaming Cheetos is probably not the best snack in the world. We got better things out there, like not things that are food-like products, but actually food. All the process that was not even like food is like food-like products. So it's like, well, we got foods, and so here's these great things you can eat. Here is the reason why you might want to start moving towards organic, non-GMO. Here are the things that provide the nutrients that their brain's going to need to develop. They're going to have the nutrients to develop a healthy immune system, a healthy gut. And so you want to get rid of the things that kind of create all these issues, and then give the body the things that will create a beautiful thing and a beautiful environment for the child to grow up in. And so sometimes when the younger kids is knowing more about nutrition is a huge factor. And if you're starting to see these kind of things happen in kids, any kind of health issues, you know that cortisol, the stress hormone, has been thrown off by whatever, lack of vitamins, a lot of toxicity coming from the foods, arsenic in foods and all this kind of stuff. Well, I say arsenic in foods, but also like Roundup, glyphosate in foods. Like, oh my gosh, how terrible is that stuff? So eating the good food, but it's thrown off cortisol. And so trying to manage stress is really great. So a lot of times what I recommend to parents is, and the parents could use help with stress too, because we live in such a stressful world, is why don't you do at least a few minutes a night of some kind of relaxation, something with your child. So you go on YouTube, you find, mommy child yoga, mommy child meditation, and you're really helping you create calm. You're helping your child create calm. You're bonding in an absolute beautiful way with your child. And by creating calm in the child who already has these things showing, the body just can't heal when it's stuck in kind of this stress mode. And so by creating calm, it really opens up the window of opportunity for the body to fix everything. And with kids being so healthy, create some calm, have a really good nutritional plan, and sometimes that's all kids need. They can just start resetting things like crazy. If the gut has gotten thrown off enough already, they could have developed some food sensitivities. Now, there's obvious food sensitivities called immediate hypersensitivity reactions, and then sneaky way foods can bug us called delayed hypersensitivity reactions. The immediate ones tend to be you eat this food every time and you feel crummy within a few minutes or a couple hours. And you go, oh yeah, you probably shouldn't ever eat a peanut again, little Paul, because you have to go to the emergency room because your throat closed up. So I know you have a peanut issue. Well, not going to do that, right? So they can be real obvious ones, but the delayed ones, these IgG ones, are real sneaky. So this is where you eat a food and it bugs you either days or even a few weeks later. And if it doesn't bug you right away, you don't know it. So the inflammation created just builds until you start getting these health issues. And so when the gut gets disrupted enough, you start developing these sneaky way foods bug you. If you already have identified that there's an immediate hypersensitivity reaction, like kids that don't tolerate formula well, cow's milk dairy formula, and you go, well, we had to find some other kind of formula because that cow's milk protein seemed to really bug them. You go, oh my gosh, there's already gut issues enough to create that food sensitivity. What other foods might be bugging this child? And so with the help of like a nutritionist, a functional nutritionist like yourself, you may say, well, let's do an elimination diet. We're going to get rid of a few things here that tend to be the culprits here. And in kids, they maybe haven't been on this earth long enough to get really complicated in what's bugging them. It's probably more the common things. Well, let's get rid of them temporarily. We'll make sure we got some good nutrition in here. We're going to make sure there's some fermented foods so that you can start resetting the good bacteria in the gut and getting rid of the bad guys, manage stress. Oh my gosh, cortisol is normalizing. That helps the good bacteria come up and the bad bacteria come down the gut. And you do that kind of stuff. There's almost nothing you could not reset as a child. But if that was not enough to do it, then there's always testing that we can do to identify why that is. And oftentimes with adults, we kind of see people that have been doing relaxation stuff and have been trying to change the way they're eating, and they have been trying to exercise, and they have been taking some nutrients, but they're missing some really important parts of why they got this. And for them, they kind of been on the earth long enough that it's a little more challenging to turn them around compared to kids. And so if you can do this on your own with the help of meditation, stress management, a nutritionist, these kind of things, fantastic. The body's so great at healing. Good job, body. Good on you. You did it. But then as the kids get sicker and more prolonged illnesses, and then once you become an adult and things are pretty locked in because you didn't quite flip the epigenetics the right way before age 19, and then that's where you start getting into where some of these tests that we have, this advanced testing, is so nice to be able to pinpoint, okay, so let's pinpoint exactly, and almost like where if you get this really good help already, or you really educate yourself and are trying to help yourself, what we're basically doing is figuring out, so what have you missed? So you're doing these great things. It should help a ton, and you should be able to turn any of this stuff around because the body's so good at healing. But then we're in a position of, well, what have we missed? What have you missed? It's hard to guess right. The body's just so complicated that it can be really nice to test so you don't have to guess. And then everything you've done already has kind of set this foundation. I tend to find a lot of people, we talked about how optimism versus negativism, really can kind of create these outcomes. And so it can be so discouraging when people have changed the way they're eating, they're managing stress, they're trying to exercise, and they still don't feel all that much better. They don't feel great, at least. And then when you do testing, you can pinpoint exactly what got missed. But also, I tell them, well, you've set this great foundation, so we're not starting from scratch. So don't be discouraged that what you didn't work, because it really did. You set this foundation. It should make it so much easier to fix things now that we know kind of what you missed.
Yep. You said so much good stuff in there too. I want to kind of come back and summarize a little bit. So kind of at the beginning, I was hearing as far as to answer Ginger's original question of kind of how to show or how to pick up on signs that they may be developing an autoimmune issue. It sounds like basically things that are just abnormal, whether it be behavioral issues or, digestive issues. Those are a couple common ones. But as far as going about kind of healing things and getting things back into balance, you were talking about cortisol being a central issue. And I think when people hear about cortisol, they think of typically stress, typically emotional stress, right? Mm-hmm. But it's so much more than that, like you touched on. So it could be toxins, it could be nutrient insufficiency, chronic inflammation, stuff like that can all kind of cause an imbalance in cortisol. So I think that's really key to know. And I love from an emotional standpoint, if there is some stress in the child's life and, doing that bonding activity of like meditation, I'm going to add in therapeutic play. I have a person that I collaborate with who is really into doing that as a form of therapy because it can prove to be really effective, especially for kids and adults, right? We all need play.
We do.
Yeah. And so yeah, and then kind of diving into food sensitivities, which are so common, which are different than the frank IgE allergies that we know of that we need to carry around an EpiPen for.
Correct.
Totally different. Can be sneaky, like you said. And then also, talking about, and I think this is why kids are so much easier to heal, is that typically they have a positive mindset, especially early on. They're much more prone to just having a positive mindset and not being, not having suffered for a very, very long time, like most adults have. And, so they could potentially heal faster. But I think the mindset piece is huge, especially for adults, just kind of getting out of the negative thinking mindset, which can be really hard, especially when you've struggled with things for a long time.
I think a good example of how the kids tend to be so optimistic inherently compared to adults is I'll explain to the adults that we see with autoimmune disease, why people get them. This is what we're going to test, and we're going to be able to figure out why you got it. And it puts us in a position to make it go away. And so I'll talk all this, and then at the very end, I go, hey, can I ask you a question? And I go, yeah, sure. So you can make these go away? I always thought you couldn't, right? And so they're just assuming that they're stuck with this forever, and that's not the greatest kind of thing. Plus, they've probably done a little research to read about their illness, and they go, well, I've read about this, and it's just going to get worse and worse. I'm going to die this horrible death. And I say, well, no, you don't have to have that happen. We can actually make it go away. And they're like, well, no, I read that it's going to be a horrible death and a horrible life, and that's how it is. And I go, oh, crud, I wish you hadn't done your research and read that. Whereas a kid, you tell them, oh, yeah, we should be able to get the tummy aches to go away, and this rash, it should go away. And you'll start falling asleep around 9 to 10 rather than being up till 2 a.m. And, you'll be able to get for school and feel good and all this. And they go, oh, okay.
Yeah.
No
They're like,
question. Like,
okay,
well, no, sure.
yeah, yeah.
Because I think inherently they just like, well, if I fall off my bike and I cry and it's really going to hurt, well, I'm not going to be off my bike forever. I'm getting right back on it 20 minutes later because it'll be fine. That skin knee will heal up, and an adult would be like, oh yeah, I'm probably never going to ride a bike again. That hurt. I don't like that. I'm never going to do that again. The kids are like, it's no big deal. I'll fix it. I'll get back on it. I'll fall off again probably, but I'll be all fine.
Yep. Yep. No, I love that analogy. That's so true. So I guess I would like to know, and again, we kind of have been covering this a little bit, one being going and doing probably too much research on their own before seeing you or a functional practitioner. But what are the biggest mistakes that people make typically with an autoimmune condition?
Yeah, I think one of the biggest mistakes is thinking that you're going to be able to get where you want to be without doing some testing. It does happen, but it is so challenging because if you're making educated guesses, some will be right, some will be wrong. But I think typically you have to be so darn good to actually turn this stuff around. There's not a lot of people that can eat absolutely that clean, could manage stress absolutely that fantastic, who can, all this kind of stuff. There are definitely people that can do it, and definitely people out there. But with testing, we're able to pinpoint exactly what's going on, and that makes it so much easier because then we don't have to say, "Well, let's do this." Oh, sorry, that wasn't what was your issue, and we just wasted all your time. We can actually pinpoint exactly what's going on with this advanced testing. So, like for example, when you look at the things that cause autoimmune disease, ideally you always want to do a blood test. Let's go look at a few vitamin and minerals. Now, I tend to think that, let's say somebody is eating really well, okay? They've learned these are the high nutrient foods. I'm going to avoid the super spicy Cheetos, that I've heard they're not so good for me, and all this kind of stuff, but they may not be digesting and getting them in. And so if you can kind of know what some of the big nutrients they're lacking, and then you kind of, their gut gets healed, they can start really getting all these nutrients in, and they go, oh my gosh, this is how I was hoping it was going to be when I changed how I ate. So we always want to test for a few vitamin minerals. I don't test for a gazillion because I usually think when their gut gets healthy and if they're eating the foods that they need to, then they're going to get the nutrients in so much better, and they'll fix a lot of those nutrient deficiencies themselves. We just got to figure out the kind of the biggest fish to fry. And then in the blood test, we also want to look really closely at hormones. Now in kids, usually the only ones you're looking at is thyroid. And if a kid has recurrent infections, one of the big things I'm always thinking is thyroid, because that's how thyroid shows up in kids. It's in recurrent infections oftentimes. Where in adults, it might be my hair is falling out, my nails are brittle, my skin is dry, I'm anxious, I'm depressed, my memory's not so good, my concentration's not so good, I'm fatigued, I got joint pain, muscle pain, my ears itch. And so in adults, the low thyroid can show up as anything. In kids, it kind of tends to show up as recurrent infections. So you take a really close look at hormones, including thyroid in adults, the whole hormone symphony. And then you look for chronic infections, because when the immune system gets disrupted, one of the things happens is these sneaky infections get in. So we talked about sneaky foods bugging people. There's obvious foods and there's sneaky foods, so they can bug you. So with infections, there's infections that are obvious. So somebody gets a pneumonia and your cough is so bad, you feel like, chunks of your lung are coming up. Like, well, yeah, I got a pneumonia, or like a bladder infection in women. It's so painful to pee, it feels like you're peeing razor blades. I got an infection, and you call the doc, hey, I'm peeing razor blades. Yeah, you got an infection. And they go, yeah, I know. Can you give me an antibiotic, right? So they're really obvious, but then you got these other kind of infections that are real sneaky, and they get in with these cloaking devices, and they get in and your immune system doesn't know they got in, so you don't feel sick. But then they're able to hide from the immune system, and over years or decades, they start creating all these issues, and wherever that particular bug that got in likes to go and create issues, well, here's joint stuff and brain stuff, and here's skin stuff, and here's all this other kind of stuff. So you check for the chronic infections, and it's very important on blood tests when people have autoimmune disease, or really they're having a lot of health issues in general. Everybody needs to be checked for celiac disease. And celiac disease is the autoimmune disease that attacks the small intestine. And when that happens, wheat and the proteins in wheat, there's 62 different proteins, gluten's one of them, become like battery acid bad for them. Not just an irritant, not just, hey, it's giving you a little inflammation 4 weeks after you eat it kind of stuff. it's like battery acid bad. Now, the really neat thing about the gut, and I think this is one reason why nutrition is one of the reasons it's so important, is the gut is so interesting, where it's such a central mechanism, but you can have no gut symptoms whatsoever, but it's causing everything else you got, right? And so with celiac disease, here's a disease where you're actually attacking the small intestine. You're still consuming up proteins, like in wheat proteins are like battery acid bad, but 80% of the time, you don't have any gut symptoms, but everything else is totally whacked in the body. Where only 20% of the time, you have all these terrible gut symptoms and everything else is whacked. And so I think a great example of how important the gut is for healing health or ill health is the two main names for celiac disease. So you have classic celiac and atypical, unusual. So the classical celiac disease is you have terrible gut issues and everything else is whacked. The atypical is you got no gut symptoms, but everything else is whacked. But when you look at the percentages, 20% of people with celiac have terrible gut issues. Only 20%. So they're saying, well, that's the classic. Well, actually, that's unusual to actually have the gut issues to go with everything. Where the 80%, the atypical, oh yeah, you got no gut symptoms, but everything is whacked. Well, actually, that should be the classic. It's kind of like, well, you have no gut symptoms, but you're feeling really crummy. You're probably that classic celiac with no gut stuff. And everything else is whacked. Oh, terrible gut stuff. Oh my God, pain, diarrhea, constipation, bloating, gas, reflux. You might be that small percentage of people with celiac that actually have tons of gut stuff and everything else is whacked on top of it. So I just want to check for that. And it's important when you do these tests that not only do you know what test to run, but interpretation. So on the celiac stuff, you look for these antibodies against the proteins in wheat. And if you get to a certain level, you have celiac disease, but you can be like 3/4 of the way there. And a lot of times people are told, oh, you don't have celiac disease, which is like, oh, good, because you don't really want that if you can help it. But it's kind of like, well, you're 3/4 of the way towards celiac. So wheat's not like maybe battery acid bad, but it's getting close. And so it's so important if that's kind of going that direction that you know it, see it coming, and then get it to start going the right way. So that's the blood test. And then I love a saliva test for cortisol. It's a spit test. You spit 4 times a day. Now, usually I'm thinking if you're a mid-teenager or younger, you're going to have cortisol involved in this chronic health stuff because whatever is causing the stress physically, vitamin deficiencies, hormone imbalance, whatever, it's throwing out cortisol. But you're so darn good at healing when you're mid-teens or younger. All we got to do is figure out what's causing the stress. We'll get rid of it. You'll reset your cortisol. For anybody older than that, though, like mid-teens on, it's really good to get it because you want to see exactly what's going on. But you also know you're going to have to specifically address cortisol if you're going to be able to fix everything. Once you get to the kind of that age too. So younger, oh, they'll fix the cortisol, you fix what's causing the stress. Everybody else is kind of like, well, we need to know what cortisol is doing and address that real specifically, and then it's going to allow everything else to work for us. Everybody needs a poop test. The gut's the central mechanism. It's called the digestive stool analysis, and it looks at beautiful things like the good bacterial numbers, the bad bacterial numbers. Is your pancreas making enzymes to digest your food? Do you have fat or protein or carbohydrate malabsorption? Here are these really important inflammation markers. Here is these important nutrients like short-chain fatty acids and butyrate, which nutritionists use a lot to heal the gut, using foods with this kind of heal the gut, get rid of inflammation. One of the important short-chain fatty acids, as you know, butyrate. If it's low, higher risk of colon cancer because you can't get rid of inflammation in the gut. It'll look for good and bad bacterial numbers, but also look for all these infections. And these infections, because of disruption, are really common to get into the gut. And they're kind of the sneaky ones where it's not like I just got a viral infection in my gut and I've had diarrhea for 5 days, now it's gone. Hopefully I didn't get too dehydrated because I was trying to keep hydrated. But there's other infections in the gut that are sneaky too, that get in there, and they're actually some of the same ones that cause more of the acute stuff that might kill you when you get it. Like, let's say like Pseudomonas, and those kind of things, or salmonella, which you go like, geez, people die of diarrhea and dehydration from salmonella when you get tainted lettuce, let's say, or something like that. But the salmonella can get in there and be a sneaky dude too, and try to drag you down over years. And so you find these guys in there, parasites and all this kind of stuff. And so the poop test is a really important one. I really find testing for that, the sneaky way foods bug people, the food sensitivity test is a really helpful one. typically what I'll tell people with a well-established autoimmune disease is we know the proteins in wheat, gluten's one of the 62, and the proteins in cow's milk dairy proteins are always going to bug somebody who's got this autoimmune stuff. And so if you haven't gotten rid of it, these two together, let's go ahead and do that first. Let's give it 4 to 6 weeks, maybe 8 weeks until the next follow-up visit, the first one. And if you come back and go, oh my gosh, I cannot believe how much better I'm feeling, they're probably the only two foods bugging you. If you come back and go, well, maybe I feel a little better, maybe not much, well, then we still know those are giving it to people, but you got other ones too. And that's where like elimination diets or doing these food sensitivities to really pinpoint exactly which foods are bugging you is great, because then you get rid of the foods that are bugging you. It opens up this whole window of opportunity to fix everything, because if you're not eating foods bugging the gut, you can fix anything. Including, you can actually fix these food sensitivities. So like with the autoimmune stuff, every food identified with a food sensitivity test you could fix other than wheat. You're kind of stuck with the wheat protein issue your whole life if your body's actually started to attack itself, which is so crazy. It's supposed to fix itself, not attack itself. And so even as far back as 1961, British medical journals said, oh, people with celiac disease, terrible, wheat's like battery acid, and by the way, because it's an autoimmune thing, you need to avoid cow's milk dairy. Here it is in 1961, British medical journal goes, oh, but by the way, you can fix that cow's milk dairy protein issue. You're not stuck with that your whole life. Yeah, you're kind of stuck with the wheat thing, but not the dairy. So we've known for, now I was 1 year old when the British Medical Journal said that. Kind of with this explosion of data, though, people don't look back and go, hey, what did the British Medical Journal say about this in 1961? It's like this lost data, right?
Yeah.
And so you can actually fix all this stuff. You're not like you're stuck with all these foods bugging people. As long as you reset the gut and fix the gut being the reason why you got these food sensitivities in the first place, for the healthy gut, you can reset all these foods. And then usually you're going to want to do a test to look for toxins eventually, because all the toxins in our world and the inability to get rid of toxins from our body are really tough on the immune system and drive this autoimmune stuff. And so there's a lovely urine test that I like to do that looks for things like lead and mercury and cadmium and arsenic and uranium and nickel, this kind of stuff, right? That gets built up in people's body and drives the immune system crazy. And so ultimately you want to get rid of these toxins as part of the resetting of the immune system, bringing it back to the middle. So you get rid of all the autoimmune stuff. You also get rid of asthma and allergies and eczema. You get rid of the infections, and the infections never get back in again because your immune system is fixed. And then you get rid of cancer risk as well. And so one of the epigenetic challenges is that these environmental toxins, and I think this is why it's so important to set epigenetics before conception, because what really drives a lot of epigenetic changes the wrong way is toxins. And so everybody is so full of environmental toxins, and what they see is these environmental toxins actually cross the placenta. So the pregnant woman, these environmental toxins cross the placenta and the baby before even birth. And so there was a study that was done, I believe it was 2006, by the Environmental Working Group, EWG, a fantastic organization, where they said, hey, these environmental toxins that seem to be playing a part in autoimmune disease, but they're so tough on the brain, they're probably playing a big part in brain stuff for kids. Do these get in after birth, or are they actually there at birth, having crossed the placenta? So they did this study where they took and they sampled the umbilical cord blood of newborns. And they said, okay, here we are, 2006. There's tens of thousands of environmental toxins in our world. Now, unfortunately, we're up over 100,000 now. We're a bunch of knuckleheads when it comes to these environmental toxins, and we keep putting them in, and just a mess, and new ones coming all the time. But back then, in the good old days, there's only tens of thousands, right? And so I said, what we're going to do is we're going to check for 400 different kinds, and we're going to see if any of these are in the newborns at birth. On average, the newborns had over 200 of these 400 they tested for in their bodies at birth. Every kid had mercury. Every kid had flame retardants. Every kid had pesticides and herbicides and all this stuff in their body at birth. And the scientists go, well, yuck. I think they use, there's more scientific terms than that, but they said, yuck, that's not good. And they also said, well, we only tested for 400. If we had tested for more, we're sure we would have found more, right? So every kid is so far behind the 8 ball when it comes to these toxins. And this is one reason they think there's so many kid stuff with brain's so sensitive to toxins. Here is, developmental delays and autism spectrum disorder and ADDs and ADHDs, because these toxins disrupt the immune system. Ear infections, strep throat, sinus infections, which unfortunately translate into antibiotic, disrupt the gut, and then eczemas and allergies and asthma. Like when I was a kid growing up in Chicago, the suburbs of Chicago, we had big schools. Every school was big. So like my grade school was like 4 stories tall, right? And it was a big school. There was like one kid with asthma. It was the one kid with an inhaler. Now it's like every other kid's got an inhaler, or there's a sign at the door of 2nd grade, oh, peanut allergy in here, gluten allergy here, milk allergy here. And it's like, holy cow, this never, ever happened back then. And so they think these toxins, unfortunately, get passed on from mom to dad. And dads actually pass these toxins on too in a more kind of a funky, really funky way. Men have the same thing, but it's more sneaky. Guys like, well, don't look at me on this. I go, no, you're looking at you on this. Don't blame mom. Holy, you're right there too. But this gets passed on from generation to generation. But one reason they think that 80% of people with autoimmune disease are women is there's so many bad genes on the X chromosomes, and women have 2 copies. Guys have 1 Y, 1 X. And so for a woman to be optimally healthy, they have to turn off 85% of all the genes on the 2nd X chromosome. Basically, you got to turn off almost the whole 2nd chromosome. Otherwise, you get excessive information coming from these bad genes on the X chromosomes. And then here's autoimmune disease and all these other kind of things. So it's one thing that makes it so much more challenging for women to stay healthy than men a lot of the times. Also, one reason why they think so many people with autoimmune disease are women. But you can flip them the right way, right? Get rid of the flaming hot Cheetos, you're flipping the right way. Yeah. If you eat the flaming hot Cheetos, they go the wrong way. Yeah. Well, let's eat this, and that flips in the right way, and you're flipping all this kind of stuff. And that's one reason like nutrition is so important, and managing stress is so important, because everything you do in that realm is flipping the right way. Now, then we may want to come in later and do some testing and figure out, okay, so how can we flip them even better? Because maybe you didn't quite get them flipped totally what you're doing, but man, you made a great foundation here. And we just flip them the rest of the way, and that's when people are able to actually get rid of the autoimmune disease, stop getting new ones on top of the old ones, all that kind of stuff.
Yep. Wow. My mind is blown by a lot of things that I just learned about what you said. You said so much good stuff. I'm sure.
Oh, I hope I didn't go too fast. There's so much information.
No. Well, I took lots of notes. So I kind of wanted to summarize this for people. I want to come back to the very beginning when you're talking about setting up a foundation, and you did circle back to that, because I think people do get discouraged when they kind of think, okay, well, I've been doing the work, I changed my whole diet, I'm not eating bread and cheese anymore. Those were what made me happy in life. So that. And now I'm meditating and I'm exercising, but I still don't feel like I still don't feel good. And that's just a sign, there are more things that we haven't figured out. And that's the beauty of doing more testing, and what's available these days is really to understand, you're doing everything great, and you've set yourself up to prevent additional things from happening potentially, but we still need to figure out what's brewing underneath the surface here. So with like the gut microbiome testing, you talked about the blood tests with nutrients and hormones. You talked about celiac disease, which, oh my gosh, it's the number one thing. And unfortunately, I still have a lot of pushback from doctors because it's not a classic symptoms, right? And it comes back to, what is insurance going to cover if you don't have diarrhea and weight loss, right? So with anyone watching that has an autoimmune disease or feels like you might have one, definitely ask your doctor about getting tested, or see how you can get set up with a functional practitioner to see how you can get tested in other ways. So, and the fact that 80% of people with celiac disease don't have a frank gut symptom, I'm sure is mind-blowing to people, because we know it as the gut issue, where you feel sick when you eat gluten. That doesn't happen all the time with people. So it's super important. I'm so glad you brought that up.
That's one reason why 80% of people with celiac never get tested or never get diagnosed. And if you're an undiagnosed celiac person, oh my gosh, the chronic health issues that come in your life is just the terriblest thing. But if you don't have bad enough gut, nobody thinks to test.
Mm-hmm. Exactly. And I will note, depending on what kind of test you end up getting for anyone watching, you could have a negative blood test, but you could still have celiac disease because the blood test isn't necessarily perfect. Typically, you do a blood test or an endoscopy and they biopsy, but even you have to do the biopsy right? You have to look at 7 different sites. So there are gaps still in diagnosis. So even if you've been told maybe you don't have it, doesn't necessarily rule it out. Also because, we have the whole gluten sensitivity issue, which isn't the same as celiac, which you talked about. So yeah, I thought that was all really key and important. And you talked about the saliva cortisol testing as well, and how it's important to test in mid-teen years too for kids that are showing signs. The poop test, my favorite.
It's the best. It's the best.
I love doing gut testing because it can tell it's just such fun. I mean, of course, it's not the first thing that people want to do, right? But it's stuff that it's just like we've been talking about this whole time. We can just get such awesome information from it because it can really be the key for healing and solving a lot of these problems. That's why I love it so much. I did want to bring up a fun nutrition tip for butyrate. That key short chain fatty acid, you can get that from clarified butter or ghee, grass-fed preferably for anyone watching. And ideally without a dairy sensitivity. However, I've noticed that a lot of people can still tolerate ghee even with that kind of issue. And then, we talked about the food sensitivities. I also want to bring up the matter of cross-reactivity too, right? Like you can have a issue due to a certain protein like gluten, or the protein found in wheat and other like rye, barley as well. And your body can actually look at another food protein and think it's gluten. And so then your immune system gets all confused and then it starts attacking tissue that looks like the protein. So I just wanted to add that in, that's unfortunately, this is why testing is so amazing and helpful because it eliminates the guesswork. If you're not either up for doing an elimination diet or you haven't gotten answers from that. And then also doing the toxin testing. I think what you talked about with kids just showing up with crazy amounts of toxins is terrifying, right? It's like, because how much can we control? And thankfully, we can control a lot. We can't control a lot as well, but thankfully by supporting our gut, supporting our nutrient levels, making sure we're not super stressed, drinking enough water, the basic foundational pieces that sometimes can be super hard can really protect us and allow us to properly detoxify. There's also plenty of resources out there like the Environmental Working Group. I love that you brought them up. That has a ton of resources on how to avoid those toxins because you can control a lot from your food and the products that you're buying because those are, unfortunately, especially in the US, not a whole lot of regulation or concern for the kinds of toxins that are allowed in our system right now. So, and I thought the X chromosome piece was incredibly interesting. I didn't know that. So women have to actually turn off a whole lot more genes to actually kind of quiet things down. So I thought that was really fascinating.
Can I tie that X chromosome stuff into maybe kind of a nutritional piece?
Yeah.
So being able to methylation reactions. So it's a lot of important things that methyl groups have to do in the body. And so there are foods that have a lot of methyl groups like the cruciferous vegetables. So as a nutritionist talks to somebody about why you might want to eat these foods versus those foods, one reason could be your body needs these methyl groups. And so you need to methylate toxins in the body to turn them from fat soluble to water soluble so you can poop and pee and sweat them out. But you have to methylate your DNA, and methylation reactions in the DNA are really important for turning good guys and bad guys off. And the infections that come into the body, like viral infections that can do the kind of stuff we're talking about, they go into a certain part of our cells, the nucleus, to a place called the nucleoli that makes all these proteins for the cells. Well, infections are super smart. They go in there because they want copies of their proteins, their viral proteins, to be made by us so that they have all these proteins that make us sick as all get out. So things tend to swell when they get inflamed. And so these nucleoli swell and they start engulfing the X chromosome. And then the X chromosome, because of what's going on in these nucleoli, is eating up so many methyl groups. The DNA doesn't have the methyl groups any longer to keep them turned off. And you start flipping the X chromosomes the wrong way because there's not enough methyl groups to go around for the DNA and what's going on in this little power plant, the nucleoli. And so those infections are so important as ways of turning off the good and turning on the bad in these X chromosomes. And the body is so smart. It actually kind of shoves the X chromosome to the periphery of the nucleus to keep it away from most of the activities that go on in the body. Because like that if we let that guy get involved in this, they're just going to mess everything up. So we're sticking those X chromosomes way to the side. But then here's this power plant that engulfs them. And oh crud! Now they're getting part of this whole picture, and that's just going to mess everything else up. So if you're really good at methylating, though, and you can keep the DNA turned the right way, and you've done so great with your cruciferous vegetables, or methylated B vitamins, trimethylglycine betaine is a methyl donor, SAMEs, methyl donors, and all this kind of great stuff, is you can get through this infection and without getting the DNA turned all the wrong way, because you're so good at methylating. You have all the nutrients your body needs to take care of the business day in, day out, but also when the body's in a position to really get thrown off by an infection or stress and all this kind of stuff, you have this reserve capacity that is so important. And that's where like nutrition and digesting your food is such important, because you have this reserve capacity that is so required, because you always know something bad's going to happen. You just got to have that reserve capacity to get through it.
Yep. Yep. Yeah, that's absolutely fascinating. So the methylation piece being really key as well is what I was hearing. And I can actually speak from experience that, so the chronic infections, because I have Hashimoto's, and it's been a long time coming to figure out my own root causes, to figure out my own autoimmune disease, but the chronic infections were a huge piece. And so to know the extent that they can wreak havoc on the body is super important, because not a lot of conventional docs test for those, just because it's typically a training thing, and not really knowing what to do with the information if that's not an active infection too, is what I've seen. Non-active, it's not a problem, which is what isn't true. So yeah, that's huge. And I wanted to bring up too that we can get these chronic infections not only from inhaling, from to get an acute infection, but also from permeability, or basically leakiness in our gut and in our mouth. I think a lot of people forget about the mouth piece too. Mm-hmm. So yeah, thanks for adding that in. That was really fascinating. Yeah. So let's see. I think we covered everything as far as what can be done to figure out autoimmune disease, and the testing that you recommend, and kind of how to treat and reverse, ideally, things most effectively. So just tell audience how we can find you.
Oh, absolutely. And my ultimate goal is that everybody know this information, but also for there to be ultimately practitioners in everybody's neighborhood that knows this information too, because only one clinic. We're in a nice place near Jackson Hole, so people love to come to visit us. Now with the telehealth, we can actually do virtual visits. People won't have to travel from Alaska once a year to see us. We can actually do a telehealth. It's really nice. But the main way to get all this information is through my website, which is drdavidvilstrom.com, drdavidvilstrom.com. And we have all kinds of videos, all kinds of blog posts, all kinds of information. And I really feel like knowledge is power. The more we know about this stuff, the more you're in a position to fix all this stuff. And then from there, you can access all my social media, including our YouTube channel where the videos come out first. And if somebody wants to see us either virtually or in person, there's links to my clinic, the International Autoimmune Institute in Southeast Idaho. And we see people all the time. Love the telehealth because people don't have to travel so much, and it's kind of a little tricky to travel nowadays anyway. And also we're working hard to get a book out by the end of the year. And I love medical people. Nurse practitioners, I think, are great. They're so holistic, and their whole training is person-oriented more than disease-oriented. So they look at the whole person, which is really what we're doing when we're doing nutrition, we're doing functional medicine, all this kind of autoimmune stuff. You got to look at the whole person. Don't look at the disease, the whole person. It's not the disease that has the person, it's the person that has the disease, right? And so we have a book coming out called the Nurse Practitioner's Guide for Autoimmune Medicine, Reversing and Preventing All Autoimmunity, and hope it's going to be out before Christmas. And but it's also written in terms that anybody, you don't have to be a medical person to understand it, that goes into why it's so important to be doing what we're trying to do with autoimmune disease. These are the tests. This is how you interpret the test. This is what you do when you see this lab result. This is when you retest. Depending on if it's changed or not, this is what you do in the retest. And ideally, we started to develop practitioners in every community that knows how to do a huge amount of this kind of reversal. And also, though, for people that don't have a practitioner in their neighborhood, you can go to your doctor and go, "This is the blood work I need." And the blood work we're talking about, even though it sounds like, this must be some really crazy new test where every lab in the country can run this stuff. It's not like it's like every lab, every hospital, every lab can run these tests. There's not like crazy, unusual tests. They may not be ones that these labs see ordered a lot, but the ones that everyone can do. This is the test. You get and if you can find a practitioner to do that, then you can even interpret your labs yourself. And you go, oh, well, this is the vitamin I need, and oh, this means I have to start doing meditation, and all this kind of stuff. And so people can kind of direct their own care with this information as well.
Yeah, thanks so much for sharing about that book specifically. So if anyone, if you're a nurse practitioner, if you know a nurse practitioner that is interested in learning more about autoimmune disease, definitely be sure to check that book out. Yeah, and I love what you said, Dr. Vilstrom, about just that most labs can order this stuff. I mean, maybe with the limitation of like a stool test, depending on what kind of thing you do. But yeah, I mean, main thing, like find a practitioner. There are so many integrated and functional practitioners that do know how to interpret this stuff. So if you're feeling like you're the one left to interpret, definitely reach out. Find someone that does virtual if they're not in your area, just to really get that support you need as well. But yeah, I really appreciate your time, Dr. Vilstrom. I learned a ton. I'm sure everyone watching learned a ton as well. And thanks so much for taking the time on your vacation too. I really appreciate it.
All the videos I do, we teach people how to use nature to heal. And once again, there's so much data. So part of the book is going to be a link to the compendium we put together about over 60 different articles about how nature helps human health and well-being. So my videos all are someplace in nature. So I'm either on this mountain, in this valley, by this stream, on this edge of this. We have some such cool geologic stuff, and on the edge of this ancient extinct volcano, and it's all I talk about nature a lot. And so I really wanted to have a backdrop today that involved nature. So there's palm trees down here and all this great stuff. Unfortunately, there's no plug for the computer anywhere near nature. So I'm sitting inside with a blank wall behind me going, this doesn't look like a whole lot of nature helping human health and well-being. So this is one of the few videos or few things I did without a great backdrop. But if I could have done it, I would have, because that would have made everybody watching go, my cortisol feels better. Hey, I know a lot from this time spent with David and Christina. For some reason, I'm calm too. I couldn't pull that off. I apologize.
I love that. Nature is so important.
Yeah.
I know. I could have myself in the trees too. Well, we have one question. Are you up for taking a question?
Sure.
So Andrea Bryant down here is asking, so she said she's RA positive. She has been since age 2, and she's also MTHFR positive. Do you feel they are related?
Yes, because it kind of goes back a little bit to the methylation thing we talked about. So the MTHFR has to do with ability, or actually inability, to methylate. Now, I tend to find that there are a whole bunch of reasons why people may not methylate. Well, one reason is they don't eat their cruciferous vegetables, right? Or their gut's so bad they can't even get the nutrients in from their food. And so I don't tend to test a lot of MTHFR. What I do know is we're going to make you a much better methylator. And by doing that, you'll be able to fix a ton of stuff. And so probably the inability to be a good methylator or not having methyl groups available are definitely tied into this epigenetic thing, can't get rid of toxin thing. And those are all things that then drive the autoimmune process, a positive rheumatoid factor being one of those. So they're definitely tied in. I do that test, but I interpret them a lot for people. People go, here's my MTHFR. And I go, okay, yeah. That's kind of one of those genetic things you can't flip off, kind of like celiac. You can flip a lot of genes. You can't flip a celiac disease off gene when it gets flipped on. Same thing with the MTHFR, but you can flip every other gene. You can flip the other 20,000 genes the right way, and you can get rid of toxins better, and you can do all this kind of stuff. And then eventually the rheumatoid factor goes negative, just like ultimately we talk about rebalancing the immune system, getting rid of what you got, but then in a position not to get new. So we want every autoimmune antibody that's been identified on testing, whether it's a rheumatoid factor, an anti-nuclear antibody, the ANA, the Hashimoto's antibodies are attacking the thyroid, whatever those antibodies are we can test for and find positive. Our ultimate goal is to do this and then go away. Hey, I'm not positive for that RF anymore. Hey, I'm not positive ANA. Oh, geez, my TPO antibodies for my thyroid are down to zilch. And then we go, all right, we got rid of it. You want to get better at methylating to do that, as well as these other things, but they're definitely tied together. Yep.
Absolutely, yeah. I love what you said about the 20,000 plus other genes that are connected to. So MTHFR definitely just one piece of the puzzle. So it doesn't necessarily mean you're doomed and you can't make any progress, because there's so much interplay that we're still learning about, right? We still don't know so much, but we are learning a ton that's telling us that, yeah, it has a lot more to do than just one gene mutation in particular.
And kind of like we talked about before is, people come in to see us for the first visit and they're kind of telling their story and all that. And they go, oh yeah, and I'm MTHFR positive.
Yeah.
And I go, I don't even test for that. Let's fix all the other stuff and it won't even matter. That kind of stuff. It's almost like this death sentence. It's like, well, yeah, you can't fix that. Right. You can fix everything else. And then you'll be okay.
Yeah. Yeah, absolutely. So thanks so much for that question, Andrea. I really appreciate it. Thanks everyone for tuning in with us. Again, Dr. Vilstrom, it was a pleasure. Thank you so much for your time. And I look forward to working together and supporting our patients. It seems like we're definitely aligned in kind of how we feel like how to go about it. So thanks so much.
Fantastic. Thank you for having me.
Yeah, take care. Bye, everyone.
Bye-bye.